So we are very excited that because Chowdhry is going to give us a talk around business case for machine learning and healthcare. So Vikas is the Chief Analytics and Information Officer at Parkland Center for Clinical Innovation. And he works very closely with data scientists and clinicians within Parkland team to develop machine learning driven technologies for empowering clinicians and social services to have impact in communities, which is quite an exciting topic as well. And before joining Parkland, Vikas was at Epic for 15 years, leading various efforts. So it's a pleasure to have you here, and feel free to go from here. And go ahead.
All right, cool. All right, thank you, Nargis. And so excited to talk a little bit about business case of machine learning and health today. We've had a wonderful morning of talks and hope to continue the momentum here. So what I want to talk today about is, how do we deliver long-term value through machine learning projects? But before we get there, a little bit about myself, and I have no conflicts of interest to declare. So this morning, we heard from CT and Nigam kind of the overall big picture view of how do we take our machine learning projects kind of end to end. Right, and most of us agree, this is something that I adapted from FDA's framework for AI machine learning. What does the responsible implementation of AI in healthcare looks like, right? So, appropriate data selection and management, model training, validation, evaluation, and then kind of going through the deployment stage, and then constantly evaluating that model and figuring out whether it's fulfilling the needs or not. So we all know that we need to do some of those things, but any machine learning project in healthcare is just so complex, right? We talked a little bit about, talking to stakeholders, figuring out who the champions are. We got to figure out, what are the social skills of people who are pushing for it. And amongst all this, where does the business case really fit in? And when I talk about the business case of a machine learning project in healthcare, I'm not just talking about vendors trying to sell stuff to hospital executives. I'm talking about anybody, each and every one of us who wants to push for an AI-driven project in a healthcare setting and figure out, okay, what is the value that is being derived on it, right? So many of you who have pushed for a project, try to implement a machine learning project in healthcare, you probably felt like that Tom Cruise and Jerry Maguire, right? Your stakeholders are saying, I don't care about, how well the model performs statistically or other technical aspects. Show me the value, right? And how do we exactly show the value? So the triggering part for me, kind of why I started thinking about many of these things, there are two things that happen. One is, in my professional life, there have been multiple situations where we thought we have a great model. We've done the pilot. We have shown the initial value. We talked to the stakeholders. We talked to the champions. And still, I'm not getting the approval or the funding to go from pilot to a full-scale deployment, right? What's the barrier? What am I missing here? I've done all the things right that everybody has been telling me to do. The second was earlier this year, I was listening to Professor Isaac Kohani's talk. He's at Harvard Med, and he was presenting to his biomedical class all this wonderful work that he had done. Some of the recent work in predictive models and whatnot. And one of the students said, well, these are great papers, but how many of these are actually, they're in practice, and what would it take to get them into practice? And Professor Kohani said, get an MBA. I was like, what does that really mean? When he says get an MBA, what does it mean? That's what it would take to get those into implementation. So when I got thinking about this, the reason why I need to make a business case, and I'll talk in a little bit detail about this in just a bit, is that if we want to have these four things happen for our projects, we want to scale it beyond a pilot. We want to have high user adoption. We want to make sure that the project delivers value and it aligns with organizational goals. So how do we do all of that? And the framework that kind of, I thought that would work in a situation like this, and I tried to apply it with some of our projects as well, is something that I adapted from this framework called Monetizing Innovation by Madhavan Ramanujan. So this is a framework that's typically used in kind of when you're thinking about innovation, when you're thinking about products. But what I found out was that if we can adapt it towards machine learning projects, it actually works very well in making the business case. So let's first start by thinking about what are the 4 ways in which a predictive analytics project or a machine learning project can fail the business case test. And as I kind of go through these 4, I would urge you to take a second and think about the projects that you have done yourself or the work that you have done in your own organization and see if any of those failures actually fits under any of these 4 ways in which we can fail in a machine learning project, right? So the first one here is feature shock. Now, a project with too many ideas and features crammed in. The second one is minimization. It's a high value project that is never scaled up, never moves beyond pilot. I have done gazillions of those in my professional life, and some of them, make sense. Okay, they should have never moved beyond pilot, but many of them did. But I could never find, the organizational sponsorship to do that. The third one is a hidden gem. So it's a high value project that is never funded by the organization. And then the last one is an undead, a low value project like a zombie that is still implemented, but it does not provide a lot of value to its stakeholders. So the interesting thing is that the reason why some of these failures happen is not because of technology, or they do not happen because of any other issues. A lot of them happen because of organizational culture, right? So let's talk about feature shock. A lot of times this would happen in an organization that has infatuation with shiny new objects, right? So anything new that comes in, it feels great to do it. Probably it will put us on the cutting edge, and there is an urge to do it. So an example of this would be, let's say, a predictive model that incorporates unstructured text just because it is a cool thing to do, right? Hey, everybody is doing unstructured text. Everybody is doing NLP. Probably we get to put something on a press release, and let's do that project. The next one, minimization, that comes from an organizational culture where we may have too much of good enough, right? Checking the boxes. There's too little ambition to do something that is really groundbreaking. For example, a pilot to incorporate data from at-home blood pressure device, it's done with a small cohort. An organization is getting into population health or value-based care. It's done with probably 50 or 100 patients with some sort of philanthropic money, but then eventually the organization never finds the funding to be able to move it forward from there. Hidden gem is a high value project that is not funded. A lot of times that happens when there is disruption to current business or way of doing things. So for example, a population health model that will enable value-based contracts is not utilized because organization does not want to disrupt fee for service business. What do you do in that scenario? And how do you actually, especially if you're a leader in the organization, how do you move the ball forward on a project like that? And finally, undead, a low value project that is still implemented. In a lot of organizations where there's a top-down organizational culture that may discourage feedback and criticism from below. A lot of times this is some executive's pet project. They are really taken in by maybe a vendor presentation or something that they saw at a conference. And there might be some incentives associated with doing that. And so there's a top-down push to do that project, but it doesn't provide value. So kind of think, maybe perhaps put in chat any examples that you have seen of projects that kind of fit in one of these 4 molds, and from your own experience. So what I'm saying is, you might say, okay, Vikas, I'm doing all the things right. I'm talking to the champions, I'm talking to stakeholders. I understand the data science aspect. I got the right PPV. I'm not, inundating my clinicians with too many false positives. And now you're saying that I got to have this willing to pay conversation in the organization, that's too much. It might be, but if you want to have a successful project, this framework where what price are your customers willing to pay for the value you'll be delivering to solve their needs, it's a very important conversation to have. Right. And like Ted Lasso said, taking on a challenge is a lot like riding a horse, right? So if you are comfortable while doing it, you're probably doing it wrong. Same for the machine learning project, right? If you are in your comfort zone, probably you are not addressing all the aspects that are needed to address it. And when I talk about price, I don't mean actual dollar price always. Think about all the constituencies, all the stakeholders that you have in your organization. What price are they paying when they give a yes to you to implement a project, right? So from CIO and IT, what's the direct technology cost for them, whether it's an operational expense or a capital expense, people resource, reputational cost risk. The CMIO and informatic folks, they are committing people resources, their reputational cost and risk. End users of your project are putting in time to learn a new technique or a new technology. There's a reputational cost or risk to the nurses, to the MDs who are going to be using your predictive model to do patient care. And then there's the opportunity cost. Could they be doing something else, when they're responding to alerts from a predictive model or something else that you've implemented? So kind of think through that, kind of what's the price that folks are paying for implementing it. And then from there, kind of have this conversation. This is a conversation that needs to happen constantly. What is the willingness to pay? How much is the price that they're paying? And then are we providing value at the right price? And use it to prioritize some of the features, right? So let me give you a couple of examples here. For example, if you have the very first one, if you have an idea for a model that can predict length of stay for a patient 48 hours admission, right? And you say that streamlining discharge process with the help of this model will save, X million dollars per year. But the estimated cost is 2 FTs for 6 months and $90,000 in technical cost, right? So you got to figure out if that project really is the price that the organization is willing to pay for a project like this. Who's from monetary perspective, we live in the world that we live in, where there's a lot of fee for service. There's not in a value-based contracts. Are you really going to get the funding for doing something like this that completely changes some of the discharge workflow, right? We talk about, another project there, running the model in real time versus, doing it at end of day via ETL. It will cost about $20,000 additional per year. Is that a miniation, right? Could you really talk about the value of that project where you're able to say that, yes, if this project is in real time, it's going to cost us more, but actually it will allow your clinicians to act in real time to provide X amount of value. Similarly, the last one that you see there, that's often happens, feature shock. We can license technology from a vendor that will build an unsupervised machine learning model that will be integrated with EHR. And you're doing all kind of what if analysis. Do your clinicians actually have time to do this kind of what if analysis? Is this really a feature shock where it sounds great in theory? The vendor has some beautiful screenshots and whatnot, but eventually nobody else will actually end up using it. So a willingness to pay conversation when you're having these things continuously along your project, it will really help tease out what features to prioritize, how much actual value your end users are putting to that project, and how much actually money is there to fund that project, right? I think one of the questions came up earlier for CT, that when CT had that virtual center, who funded that project? Where did the money come from it? At the end of the day, there is no mission without dollars. And when we complement some of the cultural strategies that need to be there to make predictive modeling projects successful, some of the technology and data science expertise that needs to be there, when we complement that with our ability to have this kind of pricing discussion, to have this ability to have a business case, that's really where we can go kind of from a pilot stage to full implementation. That's we can also go from doing projects that might not always make sense from financial perspective to actually something that delivers high value to organizations. All right, so to summarize, again, so if the aim is to have a machine learning project deliver long-term value, think of it like a product, right? And make a business case out of it. We all have to learn doing something like this. Willingness to pay is one framework. There may be other frameworks as well. I've found some success with using this framework over the last few months. And through this framework, you talk to your potential customers about how much they're willing to pay for an idea or innovation. Again, price is not the exact dollar amount of your project, it's the perceived value. And it also helps streamline and prioritize features, and it helps uncovers value for your project. And have the WTP conversation as early as possible in your project design, right? And have it throughout your project. So don't wait until you are 6 months down the project, you have designed certain features, you've already committed resources to it, and then you're trying to have this kind of, okay, would the organization pay to take this from pilot to production? It's already too late, right? Some of these operational expenses, some of these capital expenses budgets happen 12 to 18 months in advance. And if you wait until you are done with the pilot to have those conversations, you will find that there is not enough funding for that project for 2 more years. And that will not help anyone, and that will lead to a lot of frustration. My contact information here, I hope there were some questions. I was not monitoring the chat. I'm happy to answer any questions during the Q&A for this panel, and my contact information is here. So any questions, any thoughts, comments afterwards as well, would love to hear from everybody.